All right, welcome back, everybody. Today I have my colleague here, Zak Gabor. So Zak, he's been one of the first people that we had a long chat at dinner one time when I was finishing PT school that basically said, yeah, man, you should go start a cash PT practice and it'll be awesome. And you've got a unique experience in the field. And I ended up doing it. And we're 5 years along on that journey now. And it's been quite a time. And Zak's been someone that's mentored me before in the past. And Zak is someone that has been tremendously influential in the field of physical therapy, especially for new grad PTs and people really just looking to improve their clinical reasoning, their skill set, and how we can help change people's lives as clinicians and providers. So, Zak, thanks for coming on. So, he was the founder of the Level Up Initiative and now is the co founder of CalU, which is an online continuing ed company for basically new grad PTs. And he's done a ton to just change the way we think about what we're supposed to be thinking about critically, and getting a lot of new grads to feel more comfortable with their skill sets, but also the big thing being communication. I think as a PT myself and in the practice we see a lot of people that have failed due to the constraints of the medical system and the constraints that are put on providers. And um, Zak, you've done a lot to change that. And um, there's a lot of cool stuff I see coming out from the people in your community. It's a very strong community too. So I commend you on that. And today we really just want to talk about, that whole growth and learning process as a new grad or as someone changing career paths, getting into a new field, whether you're a trainer, a coach, or you're someone that's looking to find a new provider. Maybe you've been all around the mulberry bush and can't seem to find the right fit for you. We can talk a little bit about that as well today. So thanks for coming on, Zak. And where do you want to start here?
Yeah. Thank you. Thank you for the intro. I'm not sure. I'll first say thanks. It's been cool to time flies. I still remember the dinner. I still remember you coming to Shadow. I believe in the Medford location clinic when I had first started there. And it's been cool to see you just get after it and continue to pursue this because it's definitely not easy. And you were doing it before it's a lot more popular now. So it's been cool to see that success. So congrats. Um, yeah, I don't know. We could start with talking about some big picture things for newer clinicians or new trainers in the space, and maybe talking about some blind spots that I think a lot of us have when we first get into the field.
Yeah, so me and Zak were actually on a call yesterday talking about some business stuff here. And one of the things we were talking about marketing wise and looking, I have another company called Neuropedics. We're looking to uh, help clinicians with continuing education and improving their clinical skills. But one of the big problems is finding that blind spot, right? And so uh, let's go back to kind of what you've done with Level Up. So part of Level Up, and these are four of the big buckets of things that are missing in clinical care these days that are so overlooked, even by me as a young clinician coming out. It was like, oh, we want to talk about communication in school. Like, no, I want to learn about joint mobilization and, teach me how to manipulate someone's spine. We're like, that's cool and that helps sometimes. But uh, take us through the four big buckets, I guess, of what that stands for and
Yeah,
how that's supposed to make a difference.
yeah. So the first month, it's I hate how corny and like pop psychology this term has become, quote unquote growth mindset. But if I were to describe it in different terms, it's really about cultivating more honest introspection and humility and awareness. Because I think for a lot of us, when we go through school, we spend a lot of money, we spend a lot of time studying, and a lot of the times we're not really exposed to other bigger, broader kind of concepts that may be actually challenging what we just spent a lot of our time and money learning. So it can be really difficult to acknowledge that the things that you are learning may not be as right as you thought. And to make matters worse, the harder pill to swallow is the fact that we're learning that a lot of the things that we study in school, when we take that as gospel and apply it, can actually be harmful or have negative consequences for the clients or patients that we work with. And that takes a lot of humility and awareness to be able to kind of swallow that pill, and do something constructive about it. Because it doesn't feel good to kind of have that. It's really your whole identity gets kind of rocked. So that's where we start in the first month, is really just about like you hear a bunch of different people sharing about their different experiences and kind of overcoming that, and super helpful to just see that vulnerability. That's kind of what we're after with that as well. Month two gets into critical thinking. The thought there was that, and this is big thanks to Ramez, found like original creator of Neuropedics. He really helped me learn how to zoom out and appreciate like multiple different lenses of care. Um, and that really resonated with me because I felt like in doing that, it allowed me to still appreciate the things that I learned in school, but also understand the negative consequences of it, and also learn how to provide even better care with different models and find the linking themes across all of them. Because I think there's so much dogma in our profession, and so I think the thought with Critical Thinking Month is that we want to equip students and new grads with the ability to think more broadly and be able to zoom out so that they can kind of weigh how relevant maybe some of the nitty gritty things we learn in school are. Um, Spoiler alert, for a lot of things, they're probably not as relevant as we thought they were, but it doesn't mean they're not important. And that critical thinking piece is what allows us to really make that decision. So I think that's like a non negotiable in terms of when I'm looking at or referring to trustworthy providers. I want to make sure that their clinical reasoning and their critical thinking is on point. Because to me, that shows that they care about providing the best level of care, and that they're flexible in their approach by being able to use multiple different models to inform it. And then really the last two buckets are on communication and listening. Like you kind of mentioned before, it's not sexy. It's not something we really talk about in school. It's not something I wanted to learn about in school. The reality is, it's something we do every single day, because that's literally the majority of our interactions with patients, is hopefully listening and communicating with them, both verbal and nonverbal. But I know for me, um, I think a lot of PTs, especially, are indoctrinated into like, I never really gave a what about the subjective portion of the exam, like listening to the patient's story. I wanted to get to the objective testing, find all the problems wrong with them, fix the problems, fix their pain, bada bing, bada boom. But humble pie, like you realize that in listening to their story, you're actually able to appreciate so much more of the probably relevant clues that may be involved in their pain. So, for example, working with a weightlifter, if they just came in and I was like, oh yeah, you're bombing out your squat, or you have a massive butt wink at the bottom of your squat, because I just took some course and I thought I was a hot shot, but I didn't even ask about their programming or their recovery or any of those things that could be a huge player in the development of their pain. So it's a lot about that stuff, navigating difficult conversations with patients that come in with very firm beliefs about why they hurt that may be not super helpful, and how to navigate those in a sensitive and constructive way. So that's like the bread and butter of what we are kind of founded on.
Yeah, it's been. I mean, I went through the level up courses as well as a newer grad, and still today, I reflect on some of those pieces and those values of what we're trying to do as a provider here, and looking at that big scope of like, did I hit all these buckets with this person? And every time I go to the doctors for something, and um, for a host of different issues, it seems like most of those things are missing. It's like, to me, the problem with the medical model now is that these insurance companies dictate a lot of care. A lot of care is dictated by hospitals, and hospitals just want all these doctors, providers, whatever, to just kind of be sheep and check the boxes and move on to the next person, and make the profit margins grow higher. And like, I had someone the other day. So I have the diagnosis of ankylosing spondylitis, and I luckily found it early, managed it well. I'm doing really well. I have a woman that came in the other day, used to go to the gym 6 days a week. She has the gene for it. She has the antigen for it. She has all the symptoms of it, the flares, the searing SI joint pain, like her T spine really doesn't move much at all. It can't, it's super sensitive. And they're not treating her for it because she doesn't have an actual fusion yet. And it's like, no one has listened to her. And like, she came in the other day for a second visit and she's like, it was so good to sit and just talk. Like, we didn't even get the treatment. We literally did like basically 45 minutes of subjective interviewing.
Yeah.
And it took me 15 minutes to be like, okay, yes, we have, pain from the lumbar and SI region. We have a thoracic spine that doesn't move. You can't breathe. You used to be able to, put your palms on the floor. Now you can't even bend to touch your knees. It's like, I am going to be here. Like, I was like, we're getting you into a rheumatologist and I'm going to go with you because you need someone there to like help represent you.
Yeah.
And she's like, I've never felt so cared for. And she's like, for the first time since dealing with this for 5 years, I feel listened to. And I was like, oh, thank God. That like those things, those are the pieces that like make you feel good as a provider, that connect you with someone, and it gives them a gleaming hope of getting better too. And it's
Yeah,
like,
it's not that it's easy to do, but it's like it's such a seemingly simple thing that could have such profound impact. Like I mean that exact vignette that you just shared is, can't tell you how many times I've had that happen where they're like, "Wow, this is literally the first time I've ever actually been listened to by a medical provider." And you're like, "Jesus, like I feel like I'm doing the bare minimum by doing that." But yeah, it's a kind of a messed up system.
yeah. And so let's talk about the critical thinking piece of things. I think that's probably the most in-depth one we can go down
Sure.
as two people here that have kind of gone through this and been humbled by a lot of it by the same mentor
Yep.
that we've shared over the years. And as we talked about yesterday, um, I was guilty of this when I first came out of school, and I think it still goes on today. Is that a lot of people come out, and I don't think this is just PT. I think this is all types of different schooling and industries and everything else. But there, my view of it before was, and sometimes this is actually true too, in my opinion, is there are these old school people that have been doing it their way, stuck in their ways. They're not keeping up to date on the literature, whatever. They do what they were trained to do when they left school and have just kind of been, going through the motions with it. And then you have these new grads coming out that are taught the biomedical model of, you have a herniated disc, you have pain because you have a herniated disc, which isn't true. And then we start teaching them pain science, and we don't want to put our hands on patients anymore. We think we're better than our professors because, we're more up to date on the research than them, or so we think. And there's a lot of in between there, and there's so much gray area, especially in this field. And there's so much debate, and the jury's always still out on everything. So where can we start with that?
uh, you know what? I will start with one of my favorite quotes. You know what being wrong feels like? Feels like
No.
being right. It feels
Yeah.
like being right. Being Wrong by Catherine Schultz is an all-time must-read, I think, for anyone, because it really humbles you to the blind spots, and I think it speaks to like this process, this repetitive process that happens where it's like first you go through school and you spend all of your time studying all the things you learned in school. And if you don't have any professors that expose you to anything else, you come out thinking you're hot shit like me because I graduated at the top of my class. I knew my biomedical knowledge inside and out, and my confidence was so high. But I wasn't aware of anything. I wasn't aware of any of the conflicting models. So then what happened was I learned about pain science and more of the biopsychosocial model. And then immediately it's like everything I just learned out the window. I'm like, oh my God, how could they have taught me that? I feel like now I'm the knower of things and they still don't know anything. And now it's like I just have this new sense of overconfidence about a new set of knowledge that I have, only to be humbled 6 months later, a year later, 2 years later. And it's this like iterative process that continues to happen, but the degree of like the steepness of like the drop from like the overconfidence to being humbled gets little like smaller and smaller as you develop this skill of critical thinking and learning to assess for blind spots and holding things with a little more loosely so that you're not getting so wrapped up into it. So I think that would be a starting point for the discussion. But I just love that book because everyone thinks that they are right, but it's like you don't know what you don't know. So how could you feel wrong?
Yeah, exactly. And the thing I've seen too with some students and things is they come out and they have this utter confidence about everything they're doing and it's going to work. And, maybe we put our hands on someone and, oh, yeah, their range of motion is better. Cool. But was that the issue that was actually causing anything? And is that going to stick around for the long term? And there's so many other factors here. Did they get better because of you? Was it time? Was it placebo? Like, what actually got them better? And I think a lot of people don't actually stop and think about that.
Well, and it's hard because, well, it's there's several reasons. I mean, part of it is that the system is so high volume that I don't think a lot of clinicians even have time to think critically. Thinking critically about that stuff is exhausting. Like it demands cognitive resources from you and energy resources. And it also doesn't feel good to be wrong. So I don't blame people for not thinking about that stuff. It's kind of a pain in the ass. You know what I mean? And to make matters more complicated, people get better. Right. So they're like, oh, I got people better. So like, why should they have to question it? And I guess for me, it kind of has always been like an integrity thing where I felt like my integrity was compromised if I was okay with providing something I knew was not really supported fully or had really shaky evidence to support it, or if there were better ways to do it. I felt like I was compromising my integrity as a high value provider that really cares about providing the best level of care for my patients. So, that was enough of a driver for me, but it's tough. I don't blame people for it. It's a really weird landscape we're in.
For sure. And what year did you graduate PT school?
2015.
Okay, so yeah, you're a couple years ahead of me. So I was 2017, but I feel like I'm at the point in my career now where I've gotten enough reps in now, but I'm nowhere near where I want to be. Um, but when I was a new grad, I was like, yeah, we're doing all the things, we're fixing everyone, everyone's getting better, this and that. And it was like I was so shut out to the things I missed almost. Um, it was like you wanted to blame the patient, like, oh, and sometimes, the patient has it takes two to tango here. Like,
Yep.
I don't put that monkey on my back to say, hey, I gave you the resources, I gave you this and that. Like, if you aren't, if you're going to go against me, like, that's one thing, right? But now it's like, okay, I'm at the point where I've seen all the things, and with the big help of Ramez too, of putting all these different perspectives together, seeing that they can all align and play well when we really understand them well, but
Yep.
being able to reflect on everything too and feel okay enough to be like, you know what, I missed that, or a new case comes in, it's like, oh, you know what, I think this other person had that same thing going on, and I missed that there, and it's building pattern recognition over time, and like, Connor's a younger PT than me, so he'll be looking at the case, and I'm one of my main things I've always told him is like, hey, you got to look at the forest and the trees, every
Yeah.
single one of them, and then like pick which one is the bigger problem here that we might need to zoom in on a little bit or zoom out. You're like, you're looking too far at this, uh, and at this point, like I'm not old enough and I haven't been doing this too long where I'm jaded and don't give a shit and like I'm out of touch with the literature and everything else that's going on either. So uh, that piece of critical thinking right now is really the biggest part of me continuing to grow my practice. Like I did a lot of continuing education up front. I've taken a lot in, and like I used to think like I take a course, you know it all, and now it's like I'm now back to like digesting courses that I took 2-3 years ago. Like we took the Greg Lehman course, a great course, and there's still things I'm unraveling from that, and and learning how to piece them together for certain patients in a certain way.
Yeah. Yeah, no, those are all good points. And I would say that is, we kind of spoke about it, but like the number one quality that I look for when I'm looking at like a super skilled clinician is that ability to assess the, how relevant are the forest and the trees, every single tree. And I think school teaches us one lens of looking at all the trees, but the problem is there's also other lenses of looking at all the trees, and there's a lot of lenses of looking at the forest and how the trees interact with the forest. We miss a lot of that stuff. So there's a lot of shit going on that we need to be thinking about. And you're right. And I think as a profession, we tend to, on a whole, make a stink of things that probably aren't, like, we probably tend to zoom in a little bit too much at times, where we're just missing big picture stuff that needs to get done. But I definitely think there's the flip side of that, where there's the jaded clinician that has kind of gone through that first existential crisis of feeling like nothing they learned in school matters, and now you don't give a shit about any of the more like, zoomed in things that may matter and may be relevant. So it's like finding that balance. I think part of it just takes time, but like having mentors to help you learn how to reconcile all of that with like a balanced approach, I think is the way to go.
Yeah, and it's interesting now too. So for me and the way I saw it, so when I was in school, there was no talk in school still of pain science, but it was out there. So I, somewhat similar to you, it sounds like I was a psychopath in school. I want to know all the clinical tests. I want to know all the biomechanics, all the
Yeah,
biomedical
I
stuff.
remember. I remember when you came to Shadow and you were a hardo, like, you know, I related to that. So like I totally feel you there.
But at the same time, I was still open to. I was like, "What is this PRI thing all about?" I'd study all day, and then at night I'd listen to podcasts about like the extras in the field and watch YouTube videos and all these different things. Like, what is PRI? What is SFMA? What is DNS? What are all these different things that I'm interested in that seem like there might be a bigger or better solution to what I'm learning in school. Um, but to be able to take it all in now and keep reflecting on it has been something uh, we've done. But now it seems like school has been getting up to date. Would you agree schools are getting up to date with pain science literature and teachings, or no?
Not on a whole.
No. So what I'm kind of observing now is, so in the cash based world. So I'm part of a big mastermind group in the cash and hybrid physical therapy clinics, and I was talking to, there was like 15 of us clinic owners out here complaining about the new grads, that a lot of them are coming out as like these pain science hardos,
Mm.
that you know they're set of like, this is the way we need to do things and everything else is wrong. And a lot of them don't even want to put their hands on patients, which might be good for certain people, but there's also people, when you're coming in, you're paying $250 an hour or so, want to be touched, want to feel cared for in that way. There's like something we might or should do. It's an expectation of the patient. And some of these clinicians are just refusing to do it because of some of the literature that stated, it creates a dependency model, XYZ,
Yeah.
which to a degree it can. But now it's almost like I see the ball shifting back the other way of like, we're starting to see that like, oh, there was some clinical practice guidelines came out saying like, yeah, dry needling actually can work and be helpful for certain situations, and things like that.
Yeah, no, and I mean, there definitely is a rise in programs adopting more kind of pain science and BPS type of stuff. But that's the thing, right? It's like even now, like as someone that was a pain science hardo and pain science evangelist, I've changed my stance a bit as well, where I have a lot of critiques and issues with really the PNE, like kind of like the classic pain science neuroeducation paradigm that is the paradigm that's very much starting to become more and more apparent in school programs,
Mm-hmm.
because it can kind of have this like interpretation that's a little bit radical and over the top, where we're repeating similar problems there that we were with a very biomedical model. So it's one of those things that it's like the same way I feel about the biomedical model. It's like, you need to know this, you need to learn it, but you also need to take it with a grain of salt and you need to know your blind spots. Like when people ask me if they should take a Lorimer Mosley course or Adrian Lau course, I'm like, yes, you absolutely should learn about the PNE paradigm, but you need to take it with a grain of salt and you need to take it with being aware of some of these blind spots. Because if you drink the Kool-Aid too much, there's a lot of negative consequences that can happen from that as well. So it's like continuing to be humbled and not get too wrapped up into any one thing, especially when they're kind of polarized.
Yeah, for sure. And so uh, the the whole thing about that, and then wrapping that into the growth mindset, I think is another big piece of what we need as providers. Is um, we always want to be growing and flourishing, and it's like some of us have grown so far to go in this polarizing spectrum of care of let's only do pain science or let's only do biomedical. And I think that's kind of one of the whole problems too with the medical model now is like there's just there's so much overlap, or there should be overlap between professions, and there's not, and it makes it hard for patients to actually get what they need. So actually, I'm doing another episode today with an ENT specialist who's trying to get the ear, nose, and throat community to start working with dentistry. But there's like such a divide in the scope of practice and everything, because like
Right.
sleep apnea is something that's a huge issue for a lot of people and affects
Yeah.
health in a lot of ways, which as a physical therapist, sometimes we can actually address with people and help them with some of it in certain ways. Um, but I'm actually like a candidate for a sinuplasty and a septoplasty. And, but, I went to the doctor and, you know, I told them, I had a hard time breathing, and that's all they really asked. And then she gave me medications and told me try these for 6 weeks. I came back and she's like, her answer was, okay, those didn't work. I think you should see an allergist, but we can do surgery too.
Yeah.
And I was like, well, you didn't even ask if I snore,
Yeah.
which I snore like a chainsaw, but
Yeah.
um, she didn't take my blood pressure. She didn't
Yeah.
ask me about how I felt when I wake up in the morning or anything else. And, she might be a sniper of a surgeon, but it doesn't make you feel cared for when it's like you leave that office and you're thinking, what does she actually know about my condition? Like,
Yeah.
is this? And so my thing leaving there was like, maybe I do need surgery, but I have no idea, because she didn't look at anything besides she took a 6-foot tube and shoved it up my nose and then did a CAT scan
Yeah.
and said, your anatomy is okay. But I was like, okay, well.
Yeah. It's brutal, man.
So going into the growth mindset thing of how do we get clinicians, or how do we even find clinicians that we as patients know are doing the right things uh, to help you as a patient, but aren't so extremist in their view of this is what we need to do, because I heard a saying a while ago. It's like bakers bake, fighters fight, and surgeons cut.
Mm.
So how do we know we're going to go somewhere and get an unbiased opinion that's best for us? And how do we as providers do that too?
how do so how do we as providers become providers like that, or how do we as providers find providers if we're seeking medical care?
If you're a patient, not necessarily if you're a provider, but if you're seeking care as a patient,
Yeah.
how do you know, or what do you look for in someone that is, uh, altruistic in their look on care and helping people, and then as PTs, how do we, or just clinical providers, how do we do that? How do
Yeah.
we become that growth minded individual that's still in the right direction with things and not too extreme?
Yeah. Um, so I think I can start with answering the second one first because that's an easier one for me. I think the biggest thing we can do to do that is like you need to find role models that demonstrate that behavior. I mean, at the end of the day, medical professionals graduating are being influenced by wherever they go to school, whoever their mentors are. Like, these are the people that have direct influence on the characteristics and the values. So if they have role models that demonstrate this humility and desire to keep growing and having this balanced thinking, I think that's how we can have people grow into that, because it's a values based thing. It's the values they need to adopt, not anything else. Like that's what drives the behavior. Um, I think that for like clients or patients looking for medical providers, step one would be like, like genuinely are they even like genuine for a second about, like, are they trying to even listen to you or ask you any questions, or is it like they literally just breezed in, breezed out, and like asked you two questions, touched your knee, and then left? Like if that's what's happening, that's a red flag. Like that's, you probably want to go get a second opinion. I would say if you find someone that's showing that they're actually genuine in their listening, and they are open and transparent about kind of the different options, I think that's something that would be a key for me, is like any provider you're going to, if you ask, like a good question to ask them would be like, what are the potential different treatment options? Because generally speaking, there are different options, whether that's not doing anything, whether that's this conservative method, whether it's this other conservative method, whether it's surgery. Like there's usually multiple things that can be done. And the patient deserves to have a clear, transparent understanding of what those different things are, and then the provider giving their expertise, based on the evidence of what might they recommend, combined with what the patient is thinking. But I don't know, I feel like those would be some of the big things. And if you can, I mean, that's, I think, word of mouth, and like having friends that you can ask, like that's huge, to be able to find trustworthy healthcare providers.
which is really hard these days. Not so
Yeah,
much that they're even, not that they're not trustworthy. It's just the constraints of the system are insane on the medical system right now.
it is, but that's where, so like that is something that we're working back towards. And that's so like when Clinical Athlete first started, they were a directory. It was for providers who demonstrated these exact values, that weren't going to tell them to stop doing X because some bullshit reason. And so like we're building back towards bringing back another provider directory, because this is a huge issue. And like in our Facebook group, every single day, literally every single day, we get at least one, if not multiple, PTs or clinicians or coaches seeking referrals for loved ones or friends, because they don't trust people, and rightfully so. Most medical providers suck. So like why would you, like, I would want to get word of mouth. And so I'm proud of that community we've been able to build, because there are a lot of really incredible providers who like demonstrate this type of behavior and provide this level of care for people.
Yeah. I've been part of that too, and I've been happy to be part of that because we've actually gotten some pretty awesome patients from being on that directory that used that to find us, and
Love it.
it was always a very good fit for them. So shout out to a Clinical Athlete there
Yes.
for being part of giving patients the access to getting the right care.
Yeah.
Uh, I'll say too, I think, and this is kind of a shout out to the physical therapy industry in itself, but we go in. So I actually had a girl this morning that came in for an eval, and she had a partially torn ACL. She hurt it skiing, but she does some recreational skiing, nothing crazy. She does some hiking, and she works out in the gym and does some strength training on her own. And the surgeon told her she needs ACL surgery. Like she needs it if she wants to get back to normal life. She's 2.5 weeks out from getting hurt, and she had full range of motion with minimal pain. She was able to score an 18 on an FMS, which is a very high score, which means you're moving pretty well for those that don't know that. Um, she had a negative Lockman's test. Like I couldn't really tell the difference between her right and left. And I was like, I was glad she came. She's like, I'm petrified of surgery. I don't want surgery. And I was like, yeah, I don't blame you. I was like, I don't really think at this point you need to go, if anything, we can rehab this conservatively. I know guys that are skiing that don't have an ACL. I have another patient now. He's had no ACL for 25 years and he's fine. I go, the worst thing is it ends up tearing and you still need surgery. I go, but that's always something down the road and maybe you'll never need it.
Yeah.
But you can never go back from a surgery. But she went into this guy. I was like, and I asked her, I was like, how long did this surgeon spend with you? She goes, it was the quickest visit I've ever been to. It was probably 3 minutes.
Yeah.
And I was like, man, we just, I think as patients, we just need to realize like these providers should be asking us a fair depth of questions about who we are and what our life looks like and what we're trying to get and what is our goal of being here.
Well, yeah, and part of that is like patients learning how to advocate for themselves. And that's where like you going in with your client, like love that. That's awesome. But it's like, you know, I think more people are starting to learn like how like what questions to ask. And because if you ask like what is the surgeon going to do, like run out and you know tell you to kick rocks, like they'll, I'm sure they'll answer stuff if asked, and if they don't have a good answer, then you know for sure that you shouldn't be doing that with them anyway. But you know, that's definitely something I would encourage clients to hopefully learn how to, that skill of advocating for themselves a little bit more.
Yeah, and I would say too another thing, and Ramez kind of taught me this is never believe someone that says always and never,
Mm.
always or never. And I think that's true there. I think there's always different options people have. And if you go into a medical provider and they tell you, this is what you need, unless the signs are obviously clear, like if she had a positive full tear of an ACL, she wanted to get back to playing soccer. She had a positive test for the Lockmans, whatever. Like, yeah, maybe you do need ACL surgery. But in many cases, there is no cut and dry to the health
Yeah.
and vitality that you want for yourself. So I think providers should be giving more options to people versus just being like, nope, this is exactly what it is. I have to go to my next patient and this is what we're going to do. And that's it.
Yeah, 100%. 100%.
And um, anything else as far as like the growth mindset thing you went through in the modules or anything?
No, it's just learning how to continually humble yourself and want to humble yourself. It's hard. It's easier said than done.
Yeah. And what was the last module? I forget.
So it was like when we originally created it, like listening was the third month and communication was the fourth month. Then we ended up just making communication months 3 and 4 as kind of a broad topic. And now it's exercise. Now the last month is exercise. Month 3 is communication. Month 4 is exercise.
Nice. That's the big one we need in PT is exercise. So as far as finding the right PT, Zach, what do we want in a PT?
What do we want in a PT? Tuh. Well, if you're going in and there's a jillion people running around the office and it's just pure chaos, probably, I mean, you may find some good people within those systems, but that's really not a place you want to go. That's not a place you want to be. So that would be like step one from like environment. Step two, an environment, you're looking around the PT office, wherever you're at. And if you don't see any sort of weights, or like any type of training equipment like that, that would probably be another sort of red, yellow flag for me. Again, like there's nuance if the eval office is in a separate satellite thing from where the treatments are going to go, whatever. But generally speaking, you'll have an understanding that like if you don't see training equipment, that would be another yellow to red flag. But in terms of the actual provider, I mean, just what we just spoke about with the medical providers, like it's the same thing. Like, are they brushing you off? Are they asking good questions? Are they genuinely listening and curious about what's going on? And are they being open and transparent about what they think is going on, what the different options you have to manage this are, and getting feedback from you? I would say those are some of the big things.
And I'm just curious because you've been doing a lot to start to integrate the principles of strength training into physical therapy and physical therapy education too. So where are we going with that? Because I think that's the biggest thing, and it's the saddest thing about our profession is for the profession itself and for patients is, when I went through school, when I was an undergrad as an exercise phys major, we had one lab on Olympic weightlifting with Devin McConnell, who's an awesome strength coach, who's now with, I think, the Arizona Coyotes, but no one even could lift a weight in the class. Half of my class didn't work out. And then the other lab we had one other lab in undergrad for lifting, which was student led. And the person teaching the deadlift just said, yeah, you take the barbell and you lift it off the floor. And I was
So
like, God, not that's not a deadlift. That's not a deadlift.
so you know what? Here's what I think is actually the biggest problem with the exercise that we do get in school is, again, it's kind of back to the paradigm or the lens in which it's taught. We're taught exercise through a very fragile model. We are taught exercise through an overly medicalized, what we would kind of call a kinesiopathological model, aka there's a right and a wrong way to move, and we need to be careful about how we're stressing certain joints, otherwise they're going to hurt or whatever. Like, that's the lens in which we are taught exercise in school. And that is a problem, because even if people are taught like a deadlift or whatever, they're usually coming at it from a very uh
You need to do it this way or you're going to get hurt.
yeah, exactly. So it's, for me, it's even starting with just a paradigm shift of how we're even thinking about stress and exercise. And again, back to this balancing act of, like, it's not like form doesn't matter. There's an optimal for sure, but there's no right or wrong. There's a lot of nuance and there's a lot of gray, and we can generally adopt a much more movement optimist type of approach to exercise, which can still consider all of these very nitty gritty biomechanical factors, but weigh it in the context of how much does this matter for this person. And so that's where I think exercise needs to go for this profession. Is we need to stop making such a big stink and creating these unnecessary, unintentional barriers to people engaging in movement. And we need to learn how to give people more freedom and more options to engage in movement in a way that's going to help them build confidence.
For sure. And so are PT schools doing more now to integrate these things? I've seen some courses now out there are doing like a strength and conditioning aspect of PT and things like that. But for the most part, there's plenty of professionals I've talked to in the field too that just. I met up with a chiropractor that she was saying she like understands movement, but then I was like, yeah, I think I need a trainer because I don't always know if I have the right form. And I was
Yeah.
like, you're a movement provider. Like
Yeah.
how do you not?
Yeah,
So
I same with the pain science stuff. There's pockets of schools that are like adding electives, or they have good people teaching the electives, or they have good people doing like the TheraX course, but I would say that it's still very much a minority, because the majority of it is still very much the kind of overly fragile approach to exercise that is still getting taught at the majority of PT schools.
yeah, for sure. And so, for me, for Zach, for probably most of the people listening to this podcast too, that are interested in health and movement, you should find a provider that is one that has some type of exercise, personal experience with exercise, whether it be strength training. If you're a runner, go see someone that's, does marathons or something like that, that really understands who you are, where you're coming from, and that knows where you're trying to get to. I think that's the biggest piece at the end there.
Yeah, definitely.
So, anything else you want to add, Zach? I know you got to wrap up here in a minute.
No, I enjoyed the conversation. I love the work you're doing. So, I mean, we are, I think, younger professionals are stuck with the choice of, like, you kind of got to make something happen. Otherwise, you might end up in a situation that you blink and you're not super happy with it. So, kudos to you, and excited to continue to watch on.
Thanks, man. Yeah, it's crazy to think back and see where we are now. Now we have a podcast, and like I looked the other day, we got like 2,000 listeners and things now. I was like, I
Let's
never thought.
go.
Yeah,
The glow
so
up.
that's right. But Zach, where can people find you?
ZakGabor.dpt. That's my Insta, or at the Level Up Initiative is the other Insta for the education company we run.
And how do you spell Zach?
ZAK. Thank you for the
Zach.
clarification. ZAK. Gabor, GABOR.dpt.
Yeah, check out his stuff. He's got some awesome stuff up there for, especially if you're a new grad PT, and you're looking to really make sure you're doing the right thing, not only for you, but for your patients. And they'll humble you and make you a better person for it. So, Zach, thanks for coming on. And we definitely got to catch up sometime soon.
Yes, we definitely will. And shout out to UML, because they are one of the schools that are doing good things to add in pockets of some of these electives with strength and conditioning and pain science. So Just shout
Is
out.
that from our boy Kyle Coffey?
It's Kyle, but Dr. Fox has been putting
Has she?
Jenna Matera put me on, and so I've been going back there every year to give my pain science lecture, and Jenna does an exercise lecture. So um, they're
Where's my
starting,
invite?
might be here now.
All right, let me know. I'd love to do that.
Yeah, man.
All right. All right. Thanks, Zach.
Thanks,
And
brother.
everyone, next time coming up on the show, we have Dr. Kandula. We'll be talking about the ear, nose, throat, breathing, sleep apnea, and navigating the optimization of breathing for health and longevity. So stay tuned for that one.